The first speaker of today's webinar is Dr. Vinky Rughwani, sir. Dr. Vinky Rughwani is actually will be speaking today on the physical health issues. Most probably, the children are facing during the COVID-19 and the expected third wave. How we are going to handle. But before inviting him on the platform, let me introduce him. Dr. Vinky Rughwani is the MBBS, BCH, and a child specialist at Rughwani Child Care Center and Hospital. He is also the Vice President of Maharashtra Medical Council, Mumbai, Government of Maharashtra. Also member of Maharashtra State Pharmacy Council, Mumbai, Government of Maharashtra. He is governing board member of Maharashtra State Blood Trust Transfusion Council, Mumbai, Government of Maharashtra. He is also president of Thalassemia Society of Central India, organization working for welfare of thalassemia and sickle cell patients and prevention of this illness in Central India. Sirs, there are a lot of awards and achievements in the in Vinky Rughwani sir's profile. So without taking much time, I'd like to invite Vinky Rughwani sir for his presentation and addressing the participants on this important topic today. Thank you, sir. Over to you.
Thank you so much, Dr. Raka. Of course, I'm grateful to Major General Manoj Kumar Bindal ji, to Dr. Santosh Kumar ji, our own President of Sindhi Hindi Vidya Samiti, Honorable Dr. Shri HR Bakru ji, General Secretary Dr. IP Keswani ji, Shri Neeraj Agrawal ji, Principal of DRB Sindhu Mahavidyalaya, Dr. Pense, Naveen Agrawal, and all dignitaries who are present here. Since last 1.5 years almost, we are going through many things about this COVID. There have been many seminars, conferences, discussions, meetings, and being a office bearer of Maharashtra Medical Council, I have been participating in all these seminars and conferences and all the meetings. But of course, this opportunity is different. I am playing on the home pitch because, of course, our own Sindhu Mahavidyalaya have been given this opportunity by NIDM. So I really thank NIDM for giving this wonderful opportunity to our college. Of course, the topic which has been given to me to speak today, the topic is somewhat which was very much in the picture because once the second wave ended, everybody was having in mind that the third wave will come and the third wave will be more of involving children. So that question mark, which was in the minds of crores of people in this world, is now getting clarified slowly. Now today we are going to discuss what happens if a child gets COVID, number one, and how we can manage the COVID if a child gets COVID, how this COVID can be prevented in children, and what are the things which are surrounding around these children as far as this COVID era is concerned. So I will like to take permission to share the screen. Can you see the screen? Is it okay? Okay. So today, the topic which I am going to speak is, of course, about the physical part, because mental part will be taken care by Mr. Agrawal. So I'll be talking about the physical part of this. Yeah. So see, we saw in first wave in 2020, second wave in 2021. So what was the difference between the two waves? We saw a number of cases up to the March 31st, 2021. There were 1 crore. And after this, till today, we have seen 2 crores. That means total more than 3 crore cases. That means the second wave number of cases were more. Also, the mortality which we saw was more in the second wave. The transmissibility, that means the transfer from one patient to other patient was very fast. We saw in the first wave that if in the family of 10 people, if one gets COVID, the other 3 people in the joint family will be were affected. In the second wave, the same number had gone to 6 from 3. That means the infectivity, the transmissibility was there. We also saw that in the first wave, the complications that started in the second week of the illness. And in second wave, we could see the complications were there even on the 4th day, 5th day or 6th day of the illness. That means even in the late first week, we saw the complications. And the most important thing is we could see the number of children who were infected in the second wave, which was negligible in the first wave. So in the second wave, there were many things which we could observe, which were not there in the first wave. So now the question is third wave. Now this is a $1 billion question. I think everybody has in mind that third wave. Now we have seen that the world have seen 19 crores of cases, and in India is almost more than 3 crore cases. And this difference, I told you that most of the cases are in this particular last few months only. And the vaccination we have covered is 80% who have received the first dose and 20% only who have received the 2 doses. So that is most important thing which will determine the third wave. And we have heard that it has already started. Third wave we have seen in UK. Almost today 30,000 cases are there in UK. In our country also, we are getting almost 30,000 cases per day as on today. So even we have the second wave is declined, but it's still going on. And when this second wave will turn to the third wave, nobody knows. But looking at the past and the previous experiences of other countries, we are bound to get third wave. That is very sure. But we expect one positive point over here, that previous pandemics also we saw that first wave was one, the second wave was the highest one, and the third wave was the lowest one. So if same trend goes, it all depends on our vaccination coverage. And we all see that our country has vaccinated 20% of the 40 crores. That means overall, if we see that the number of coverage is quite less. And we all know that if we want to finish this pandemic, we have to achieve a coverage of 70% people in our country, or at least we can say 90 crores to 100 crores people in this our country, and that can be achieved only by vaccination. There is no other way by means of which we can achieve this figure. And for vaccination also, we will be discussing vaccination in our next following slides. But we know that even today we are vaccinating above 18 years. We have not started vaccinating our children. So our children below 20 years of age are almost 35% of our population. So if we are not going to vaccinate our children, we are leaving 35% of the population. The total number of population that we will be vaccinating will be 65%. That if even if we are vaccinating everybody to all, सबको अगर वैक्सीन लगाएंगे तो भी हम लोग जब तक बच्चों को वैक्सीन नहीं लगाएंगे हम हर्ड इम्यूनिटी अचीव नहीं कर सकते. So no question by means there is no we can say that is this pandemic cannot be ended till we give vaccine to our children. तो बच्चों को वैक्सीन लगाना बहुत जरूरी है. तो अब थर्ड वेव आएगी ये पक्का है. थर्ड वेव कब आएगी हमें नहीं मालूम, लेकिन जो ट्रेंड है वो ये बताता है कि यह थर्ड वेव कभी भी अभी आ सकती है. सो वी विल टॉक अबाउट सम symptoms also. We know that in adults now, because we have gone through this COVID since last more than 1.5 years. So we all know that symptoms. We know fever, cough, cold, body ache, sore throat, and all, loss of sense of smell and taste. These are very common symptoms that we have seen in COVID. In children especially, we have seen so many children whose primary complaint was loose motions and vomiting. Now, this particular complaint is actually has been seen more in children. So if anybody at the time of second wave or a first wave used to come with loose motions and vomiting, and when we used to do a COVID test, RT-PCR test, their word seems to be positive. So that means we should keep in mind that whenever a child having symptoms which are not cough and cold and fever, which are coming with loose motions, we should keep in mind that it can be a COVID. Of course, in today's scenario, because we are in a declining stage, the COVID patients are getting down and down. So we may wait for a day or 2 or 3 to see whether it is something else than the COVID also. But that symptom should be kept in mind. Now, this is the scenario that we very oftenly saw during the second wave. Parents were positive and child was actually asymptomatic. That means the child has no symptoms. At that time, we did a COVID test, RT-PCR test, and we found that children getting positive. That means children are actually victims because they don't go out. We have seen that since last 1.5 years, they are at home only. They are doing whatever they are. They are doing everything from their home. They are not playing out, or they are not going to meet their friends and all. So they are actually victims. When parents were positive and child is symptomatic, has got some cough and cold, parents are COVID positive, 100% children are coming to be positive. So this was a scenario which we did see during the second wave. But the third one, when parents were negative and children were symptomatic, that means having some fever, cough, cold, at that time, we can wait for a day or 2. We can wait even for 3 days. We can start a symptomatic treatment. We can think of some other illnesses also, like cough, respiratory infection, other respiratory infections or other gastrointestinal infections, and then we can get them tested for COVID-19 if they are not getting relief. So this is the scenario which we very oftenly saw during the second wave, and we are going to see later on also in this COVID era. About the test. Now, a lot of discussions have been made about this rapid antigen and RT-PCR test. We all know that rapid antigen test has got efficacy almost of sensitivity, which is around 50%, or RT-PCR has got more than 70%. So we may not get positive test even after having COVID. This we all know now. So, but this test has got really has played a tremendous role, very important role. Now we are doing lakhs of tests today. We are, of course, everything has been whole management, the whole policy decision, everything is runs around this RT-PCR test. So this is a very important test. Now the cost has also gone down. Previously it was almost 4,500, has gone down below 1,000 now, almost to the. So this test has got a big role to play. Now we have got a saliva test also now, which is coming. The home test also, our kits are also coming. So slowly we will see that this COVID test will be one which will be done at our home also. So these are the facilities that slowly the cost as well as the availability will be not an issue in recent future. After this, this one is very important because many times a question comes that the small child, uh, uh, whether we should breastfeed if the mother is COVID positive. Of course, the mother can breastfeed the child, because if we see the overall benefit of breastfeeding is almost always more than what the negative effects of having a child with uh, the COVID positive mother. So, of course, the precautions like wearing a mask or washing their hands before breastfeeding and routine cleaning and all this are to be taken into consideration. Similarly, now as far as the pregnancy is concerned, we have seen the previously it was thought that the pregnant mothers, if are having COVID-19, they will have a very disastrous effect. There will be a maternal mortality, or there will be a child having so many problems. But it was very clearly seen, and the studies are there which clearly indicates that the newborns almost are not COVID positive. In few, except in rare and few cases, we could see the positive newborns having the COVID positive report. And in few cases, we will be discussing in future in next few slides about the multisystemic inflammatory disorder which is seen in children. So some sort of this multisystemic inflammatory disorder in newborn of positive COVID mothers has been seen, but that is also very rare. So overall, pregnancy COVID, which was thought to be a very dangerous condition previously, now we know that it can be taken care of quite easily and nothing to worry much about. Uh, of course, if one gets COVID, one child gets COVID. Now we have seen that adults getting COVID, they have there is a lot of prescriptions which are coming from the doctors, right from the consultants to the general practitioners. There are list of 1, 2, 3, 4, 5, 6. But in children, I tell you that we should not use all these drugs. We should avoid. Actually, we should not give all these favipiravir, doxycycline, azithromycin, this hydroxychloroquine, vitamin C, vitamin D, zinc. These are all needs to be avoided. We should not. So this is one thing which is very important, that the blanket prescription of medicines in children in COVID should always be avoided. It should always be avoided. This has to be kept in your mind. Now, about the alternative therapies. See, I am a allopathic practitioner. I also office bearer of medical council. But still, I say that the other treatment are good one. Maybe an Ayurvedic one, maybe a homeopathic one, especially to increase the immunity. But we all these, if we discuss about each and every one. See, gargling, of course, the gargling has got no side effects. Everybody can do, and it will give some benefit if not. So gargling, of course, may be advised, and everybody can do it. Steam. Steam has got good effects, but in children especially, I will put up one caution here that we have seen children who were taking steam got burns on their chest and faces because the procedure of taking steam is not very, children are not acquainted with the procedure. So we should also think in this term that steam should be avoided in children. There are a lot many immunity booster medicines, of course, not should not be used rampantly, about herbal tea and all kara and everything. People they use, people they got some benefits also. There are arsenic like homeopathy medicines also. I would like to say that these medicines are good, but overall there are not much studies which have proved that they are going to have some effect on COVID. So if you want to use all these things, of course you can. Not much side effects are there, but randomly using every person getting or is using everything over here is, I will suggest that it should not happen. So this is how we should move. This is again for children I am talking about, and but this is a general for everybody has to take care of this. Now, suppose a child has got COVID positive, becomes COVID positive. So we know that we have to give some treatment. Now, in overall, I tell you that in children, the severity of COVID is not much. Always we have seen that in adults we have a figures that almost 15% they need hospitalization. Out of 5% they need oxygenation. Out of 2 to 3% they need ICU admissions. In children, we don't get so much number of patients getting hospitalized. So children in overall COVID in children is a mild as compared to adults. So most of the children, they need only a symptomatic treatment. Symptomatic treatment means what? They need antibiotic, that means like Procin or paracetamol for fever. If they have a cold and cough, they need some medicine for cold. They get loose motions, they get some medicine for loose. So only symptomatic treatment is needed in most of the children, almost 95% of the patients. And of course, home isolation is the one which we have seen children there. Uh, I I will like to tell you something about danger signs and hospitalization after that. First, we will discuss about the home isolation. Now, suppose a child gets COVID, it's a mild COVID. So, how we will isolate him? So, he will be kept in a room. But can you keep a small child of 6 years old alone in the room? No, we can't. So, there has to be one caretaker. Maybe most of the times, her or his mother, or sometimes some other also. So don't keep more than one caretakers, only one caretaker. Everybody in the house needs to wear at least triple layer mask. The one which is taking care of the child has to remain with the child as less time as possible. But even if they want to sleep with the child in a room, they should sleep in a separate cot. So this is what. And the most important thing is the adults or having a comorbidities should be kept in isolation. That means I call it as a reverse isolation. That means the child not has to be isolated. He has to be kept with his caretaker. But somebody having an elderly people or having some comorbidities has to be isolated because the child should not go to that uh, grandparent. That is the most important thing. And another thing is we have to monitor the child for fever. If there is a very high fever, if there is a lot of vomiting and loose motions, or child is getting dehydrated, or we all know now about using pulse oximeter. So pulse oximeter has to be used if it is the saturation goes below 94, then we have to take some decision because the child will need oxygen and we have to hospitalize the child. And what about now we have seen that in adults, we are doing a walk test. That means we ask the adults to walk for 6 minutes. First, we check the pulse oximeter, oxygen saturation, and then we ask them to walk for 6 minutes. And again, we see the pulse oximeter saturation. So in children, it may not be possible to ask the child to walk for 6 minutes. What we call them, हम उनको बोलते हैं just sit and up. You do utthak baitak karo, and again we see the pulse oximeter. If the saturation is less than 94, it's a worrisome. So, and these are the symptoms that we have to look for, and we have to suggest them that this child may need to be hospitalized. So, these are the guidelines the government has formulated for children in COVID-19. Now, these guidelines are there, which says that more than 95% saturation, you have to be at home. If it is between 90 and 94, you have to give oxygen, so you have to hospitalize the patient. We call it as a moderate cases. And in severe cases where saturation goes to less than 90%, we have to admit in the pediatric intensive care units. So these are the guidelines which are there. This had to be followed. Now we have seen that there are uh, multiple drugs and medicines which have been used in COVID-19. Now, steroid has been very rampantly used in adults. In children, we don't need at all. In very few cases where there is a severe COVID infection, where there is a distress in oxygen saturation is very less, only those cases the steroid is needed, and the steroid has to be used in a very judicially, in a very dexamethasone 0.15 milligram per kilogram or methylprednisolone 0.75 milligram per kilogram, and we have to taper it within 14 days, 5-7 days, and then we have to taper it, because we have seen mucormycosis. Because mucormycosis have been seen in adults. In children, we have not seen much. Very rarely we did see, in few cases have been seen in our country also, as far as the children are concerned, but it is very rare this thing phenomenon. And the reason why children are not getting mucormycosis is because they are not requiring steroids to be given, number one. Number two, because they are not having diabetes and high blood sugars. So that's why we don't need the mucormycosis, we don't get in children very oftenly. Anticoagulants, like that means low molecular weight heparins, are only needed when we get disarranged, when we D-dimer levels are quite high. So that is also requirement we have seen, that is quite less. We don't require this anticoagulants in children. So there are so many things. Now, as far as the masks are concerned, because I would like to mention here that there is a recommendation that masks below 5 years of age, children may not wear the mask. From 6 to 11 years, they should wear the mask, but they should be supervised. Sometimes they can gag. So the mask, and above 12 years and above, everybody has to wear the mask, that we all know. So as far as the these are the I've just discussed all these things. That's asymptomatic home isolation, mild you can keep at home, moderate you have to hospitalize, and severe you have to admit in the hospital. This is if there is a severe complications, how we need to. These are all guidelines which has come from the government, and all these have been circulated to all pediatricians also in the country, even in the private setups. We are all following all these guidelines which have been given by the government. So these are the drugs we have discussed. That remdesivir need is very, very rare in children, but if there is a severity of the infection, if the oxygen saturation is less, remdesivir can be given. Steroid I have discussed, anticoagulant I have discussed, toci not needed at all. Plasma, government has now said that all the trials show that plasma is of no use. So now plasma has come out of the ethical recommendations from the government. So plasma is not needed. Oxygen, of course, is the most important drug which we have seen has been had a great shortage of this in India during the second wave. Now the things have improved. We have we have got so many plants of oxygen. The government has taken care of oxygen manufacturing, the transportation. So even if we see a third wave, definitely, as I said, that the complications will be taken care by all the amenities and the the things like oxygen that which were in great shortage during the second wave will not be seen in the third wave. That is very sure about. So extra precautions have been taken and should be taken because we may witness third wave at any time. This is one which is a polyinflammatory multisystemic disorder. This is seen in children only. This is something which is seen, which is unique for children. So those who had COVID, maybe a month, 1.5 months back, will have this serious problem after 1.5 months of having a COVID infections. We have seen children who are coming with fever, redness in the body. Their blood test shows that their liver profiles are bad. Their involvement of heart is there. So this is something which then we retrospectively see that they had a COVID 1.5 months back, or they did not have a COVID, but their parents had COVID, and at that time child was not tested for COVID. RT-PCR test was not done on the child. But so this type of is one of the serious threat for children in COVID. And the IV IgG is a medicine which is actually needed to treat this particular along with the steroid. So the government has now, as a precautionary measure, have instructed all the pharma companies to manufacture this IV IgG, which should not have a shortage if this particular pandemic, we will see a third wave, having more children and this polyinflammatory multisystemic disorder in future. So this is which is very important thing, which there are guidelines for this multisystemic inflammatory disorders from the government, and these guidelines we are following quite now. As far as the antibiotics are concerned, we have seen that many hospitals, even doctors, are prescribing antibiotics for all COVID positive patients, but actually it's not needed. It is only needed when there is a suspicion of secondary infection. Otherwise, as far as the COVID is concerned, we all know that antibiotics have got no role, and misuse of antibiotics is going to develop resistance against the antibiotics and also will harm the patients. Now, sometimes we have seen that COVID child has been admitted in non-COVID hospital. This we saw in the second wave, because you know that in second wave what we saw, that there were many hospitals, COVID centers having adult COVID centers, and pediatric COVID centers were quite less or were almost not there in all cities. So at that time, what if a child used to had a COVID, they used to admit the child in a non-COVID setup. But see, if you talk about the ethical part, the COVID patient has to be admitted in the COVID hospital itself or COVID center. But there was shortage of beds. There were no beds. So at that time, many pediatricians, they did a marvelous job by admitting this patient in a separate unit, in a separate room, having a separate staff, having a separate everything, the entry. So this we have seen so many pediatricians and private hospitals, even government setups are did a wonderful job by taking care of these children. We very oftenly see that HRCT has been advised to all COVID patients, but in children especially, I say that HRCT is very rarely required. So there were a lot of discussions about this HRCT, misuse of HRCT, and in children especially it is not needed. It is needed in a very rare cases, having a very high pneumonia with very less oxygen saturation. Now this is very important. We have seen that this vaccinated people getting reinfected with COVID. So it is quite now in UK. Now the studies are coming that now people are getting infected after vaccination also. Now we all know that the efficacy of vaccine. Suppose the efficacy of one vaccine is 70%. It means that there are chances of 30% chances that this man who has been vaccinated will get reinfection. So there is always a chance of reinfection even after vaccination. But the mortality and the severity of disease, the chances of getting admission in ICU, chances of getting hospitalization, have seen that they are reduced a lot. So there is one study which shows, which tells, which has come recently, last 10 days only it has come. The study was a very big study which was done, and it has shown that there is 82% chance of reducing hospitalization when the person is vaccinated with one vaccine, one dose of vaccine. And there is 95% chance of reduction of hospitalization and mortality when the person is vaccinated two doses of vaccine. That means this is very surely one can say, we can say that vaccine is very important to prevent mortality. Vaccine is very important to avoid hospitalization in COVID-19. Vaccination is one which will prevent the oxygen requirement. So vaccination is the most important part which should keep in our mind today. This is about the variant and the mutation in COVID-19, which is a hot topic today, because we saw that the government has somehow lifted this mission begin and all unlocking system, and then again there was a threat of Delta plus which has come. So what is this Delta, Alpha, Beta, Gamma, Delta and all? So we all know that previously there was no Alpha, Beta, Gamma, Delta. Previously we saw 1B117. So whenever whenever a virus replicates, the genetic makeup of the virus changes. So this is called as mutation. And sometimes this mutation makes the virus mild, and sometimes this mutation makes the virus wild, more stronger. So we never know whether the mutation will make the virus more stronger or will make the virus weak. So this will be now what previously when we saw in United Kingdom 1B117 came, we called it as a UK variant. We saw a few patients of UK variant in India also. Then the South African variant came, B1351. Then Brazil variant came. Then, of course, it was named as the Indian variant, B16172. Now that Delta, this Indian variant, when did come, after that the WHO thought that we should not name these variants by the countries, because it gives a bad picture of the country. Suppose the Delta variant starts from India and it goes to the world, and the world over will say that ये भारत से आया हुआ हमारा एक it has come from India, so it's an Indian variant, भारत ने सबको दिया. So they thought that we should change the nomenclature. So they called UK variant as a alpha, South African as a beta, Brazil as a gamma, and Indian variant as a delta variant. So now we don't call Indian variant, we call as a delta variant. So delta variant is a one which has created havoc in second wave. We all know. Now, as far as this delta plus variant is concerned, so this delta variant had again some change, and then it was found that some genetic material was changed in delta variant, and it was found to have something different, and it was called as a delta plus. And we fortunately could see only few cases of delta plus in our country, maybe not be more than 50-60 cases. So in Maharashtra, in our state, we did see in Western Maharashtra few cases of Delta plus variant, and that was the reason was that everybody was again had a fear that the third wave will be like Delta plus variant third wave. So that's why the unlock procedure was somewhat had some break because of this threat of Delta plus which had come. Now, but fortunately, since last 1 month, we have seen that Delta plus cases are not increasing. So somehow, even today, Delta, the old one, has got more threat to our for as far as the third wave is concerned. So we have to now, of course, the government has also taken proactive steps, and now even there are genome sequencing has been done in many places, in almost all states in our country, so that we can study this variant, and also we can study the effect of this variant, whether they are more transmissible. As we saw that this UK variant has more transmissibility. Delta variant also had a high infectious rate. The South African variant had some immunity escape from the, as far as the vaccination is concerned. That means we saw that the Covishield vaccine had got some less effect on South African variant. This was one study which was done. So this variant study is very important study. It actually gives us the overall planning for the management, planning for the vaccination. So these studies are going on. Definitely, this will definitely is going to help us in this in recent future. Now, uh, Delta plus variant, I just discussed about it. Uh, there are lot many clinical research and trials which are going on in COVID. We have seen that if we see the history of medical science, the the fastest research which has been seen on vaccination we have come across. Okay. Also, there are almost more than 260 drug medicine trials which have been taken place in last 1.5 years, which is also a unique thing which we have seen in this COVID-19. So this is just like a management of disaster, as we are uh, sitting in a umbrella of NIDM. So like this is how the disaster management has to take place. We have to do everything in a quick, in a fast manner. So which has been done as far as the clinical research and trial, especially in our country is concerned. We have done a lot many things. In the world, it's as I told that almost 260 drug trials and medicine trials for COVID-19 have been done. So we have seen that the new drug, now you must have heard the 2DG uh, drug which has come now, which can be taken on or mild to moderate cases. It is quite simple medicine, which has also proved to be quite useful now. So these type of medicines have come. This 2DG has come after actually second wave. So maybe in third wave it comes if this 2GG is going to help us. We have so many drugs which have come in prior to second wave. So the research is ongoing process. It is going in a quite a good speed, and we hope that we are going to tackle this COVID pandemic by doing so much of research and the trial. Of course, a few points about the vaccination I would like to say. Now, so many vaccines. We all know Covishield, Covaxin, Moderna, Pfizer, Sputnik, Johnson Johnson. The two, Covishield and Covaxin, our old vaccines. We all know that these are being used in our country. And of course, Sputnik has already been started in our country. Pfizer, Moderna, very soon will come in our country, because the process of Government of India is under consideration, and soon we will be getting all these two vaccines. Also, and other vaccines which are also there will be almost. I tell you that maybe in few months we may get almost 10, 20, or 30 vaccines. Companies who are manufacturing vaccines in our country. But then this particular Covishield and Covaxin, there is no difference. We all know that both are good, both are safe. Efficacy is almost same, or Covaxin has got somewhat higher efficacy, but almost same. Side effects are almost same. In Covishield, of course, the difference is only the second, about the second dose. The second dose, which was previously after 1 month for Covishield, now it has been, we all know that 12 weeks time has been formulated for the second dose. For Covaxin, it is again the same after 1 month. Uh, yes, about the second dose, as far as the Covishield is concerned, there is a thinking at the governmental level, and the medical experts are thinking of reducing the interval between the first and the second dose, which has been increased. So maybe in few in recent future, you may get news that the Covishield second dose interval has been reduced. So you may get it. As far as side effects, as I already told you, these are minor side effects. That means we get pain at the site of injection, we get mild fever, we get headache, we get body ache. So nothing serious. So many doses, as I mentioned in the previous slides, that 40 crore doses has been given in our country. And how many people have actually seen the severe side effects? These are very, very rare. So that means even with, we all know that there are, the India caters the 60% of total vaccines in the world before COVID era. That means as far as the vaccines for children and maternal vaccination program in India, we are giving 60% of vaccines of the world. So if we see those vaccination capabilities of our country, of course, this as far as COVID is concerned, we are even at the top now, almost with the at par with the America, USA. So we have vaccinated maximum number of people. Maybe our population is very high, so it is very not easy program to vaccinate the 140 crores people of our country. So this is one which is very difficult task. But if we see the number of people that have been vaccinated, our country has done a good and quite a good job. And of course, there has been a shortage of vaccine. We are seeing now. It all we expect that what was expected in the month of June, July is not. We are not actually getting the number of doses from the manufacturers, but we expect that in a future that those shortage will be compensated, and we are going to vaccinate our country people by the December. So this is what is actually we think about the vaccines. About Sputnik vaccine, of course, yes, it is also a good vaccine, having almost the same features like Covishield. So it has been made available by some private setups also, and if somebody wants that, that vaccine can also be given. So these are the things which actually we discuss whenever we talk about vaccines. So I talked about trials, efficacy. Of course, Moderna and Pfizer vaccine is 95% efficacy. Maybe Covaxin and Covishield has got less efficacy. But then if we see the mortality or the benefits as far as the severe COVID is concerned to the vaccinated people, it is same. As far as the Covishield, Covaxin, Pfizer, Moderna, it is same. So action against variant also interchangeable. That means if we take one vaccine on first dose and second vaccine on other dose, this has not been in our country, but Russia has started this. Russia, they are interchanging this AstraZeneca vaccine with this Sputnik vaccine. So this maybe in recent future, our country will also, our government, our ICMR will also allow the interchangeable phenomena, but as on today, it is not. As far as almost to every variant, all vaccines are effective. But about the South African variant, it has been, one study was there where it has been seen that the Covishield has got some issues. So otherwise, all vaccines are quite effective. Duration of the second dose after I have already in contraindication, there is no contraindication of giving vaccine. Vaccine has to be given to everybody. Only thing is having some anaphylactic reaction. Anaphylactic reaction means those who had in past had a collapse after taking some injection or a medicine. So this is very rare anaphylactic reaction. Otherwise, you have to start the vaccine. The side effects I have discussed that they are very minor. Post-COVID patient. Now, once somebody has got COVID infection, he can be vaccinated after 3 months. We all know that vaccination has to be done. They must take a vaccine even if they had a COVID infection. Now, this is about the booster dose. Now, there is a lot of talk which is going on about the booster dose. Whether you need a booster dose after giving 2 doses of vaccine. Now, in what is happening in Israel, they have almost vaccinated everybody. And even the 2 doses they have given to almost 80-90% of the people. And they have had some studies, and they found that those who had a vaccine, first dose of vaccine, around 10 months or 11 months had, because in Israel they had started earlier. So they found that there is the overall antibody level was quite less. So now they are thinking of giving a booster dose, and they have already started giving booster dose, and even other countries like US, there is some discussion which is going on as far as the booster dose is concerned. So maybe in future, in our country also, this booster dose may be needed. We all know that there are few vaccines, non-COVID vaccines, like flu vaccines. You must be hearing that flu vaccine has to be given every year, because now that is actually a booster dose. So flu vaccine, why this booster dose is needed? The one thing is that it increases the antibody level. That means the immunity power. Number two, there are variants which are coming, new variants because of the mutations, and that's why we need some other type of the vaccine with some changed module which can take care of that new variant of the virus. So these are two reasons why booster dose is needed. So in future, यानी भविष्य में हो सकता है कोविड वैक्सीन हमको हर साल भी लगाना पड़े, हो सकता है हर 3 साल में लगाना पड़े. तो ये सब चीजें जो है ये आज नहीं बता सकते हैं, बट इन फ्यूचर you may need to be given booster dose that will be decided by the experts. हम लोग बहुत बार we do antibody titer. बहुत लोगों को होता है कि मैं अपनी एंटीबॉडी करके देखता हूँ कि मेरे में कोविड का प्रोटेक्शन आ गया है कि नहीं आ गया. पर वो एंटीबॉडी एक्चुअली इट इज नॉट नीडेड, बिकॉज यू नो देयर आर मेनी फैक्टर्स कि आपको इन्फेक्शन हुआ तो आपको अगर एंटीबॉडी है तो आपको कोविड नहीं होगा. दिस इज मिथ, दैट इज नॉट करेक्ट एक्चुअली. And if you got no antibody, that means you will get COVID. So this is actually antibody titer, antibody test is not meant for individuals. वो एक particular लोगों के लिए नहीं है, वो है सर्वे के लिए. यानी फॉर एग्जाम्पल एक कंट्री में सर्वे किया या पर्टिकुलर मुंबई में सर्वे हुआ, एंड दे फाउंड दैट 50% of the people in Mumbai are having antibodies against the COVID. That means the 50% of the people had COVID in the past. So this is basically for planning purposes, and this has to be done in a public. Antibody titer doing individually is not of any use, so we should not run about behind this antibody titer. वो 1000 रुपए की टेस्ट करने में कोई ज्यादा फायदा नहीं है, and we should not go for it also. And of course this vaccine coverage is the most important thing. As I already told you that Israel has almost 80 to 90% coverage they have done. In other countries also, UK has 62% coverage. They have done 2 doses. Even other, well, there are many countries who are, as far as the percentage of the coverage of 2 doses is concerned, is ahead of our country. So this vaccine coverage is one which is very, very important, which is going to decide the fate of third wave. So we need to vaccinate our people. We need to create awareness about the vaccination in our people. The government has to proactively arrange vaccines for our people. Of course, these all are the efforts are going on, and we expect that the things will be better in near future. Now, this is about the COVID. I have told you that in general physical health, as far as the COVID is concerned, we know, as far as, because I will focus on children, we all know that children now are actually sitting in the home, giving lot of times on the gadgets. Of course, this Mr. Agrawal is going to talk about the mental status and all, so I'm not going for that. But as far as the physical part is concerned, there should be some games, yoga or breathing and chest exercises which should be encouraged to our children, because this is very, very important aspect of overall health in our country. As far as children are concerned, because nowadays the play is not there. We all know that they can't go out. The indoor plays are banned. Outdoor plays are allowed, but they are actually, even there are no infrastructure or setups or organized the things which are available now. There are no matches which are happening. So we should allow them to do, at least we should not only advise them to do some sort of exercises which can do at their home, and we should also encourage them to do such things. So this is type of play which actually we should allow, we should encourage. This is going to help them to build their immunity also. The breathing exercises, actually, this COVID has taught us many things which we never had this thing about. Now, this breathing exercise is a very simple exercise, and this everybody should do. Not only children, but everybody should do, and everybody must do. Rather, I will say this will not only for the COVID itself, but overall our lung capacity is going to increase by this breathing exercises. This chest exercises we need to teach not only our children but the whole family. So we should go for all these things. This is what this, you can see the sit less, you can see the use of televisions, mobile phones. We need to avoid it, and we have to activate the children to build their strength, to improve their balance and make them active. Of course, this is how we should. And we had seen that children who had COVID in the past should also be encouraged to do physical activities, because overall physical activities will make them rehabilitate them as early as possible, to normalize them as early as possible, and they can build out their immunity also by doing these things. So these are the health benefits of physical activity. We all know that dementia, fractures, this all cancers, or overall mortality is decreased by doing physical activities. So that should be encouraged in all, not only in children, but in all, as far as in this COVID era, not only in COVID era, but overall also we all know that it is required. As far as the diet is concerned, we always say that it should be a balanced diet. It should have green vegetables, it should have some proteins, it should have some energy rich foods. And this balanced diet has got a very important role as far as this COVID era is concerned, because not only for the those who are having COVID positive, but overall for the prevention and other aspects also, we need to have a very healthy and balanced diet. In, of course, this trend has rather increased in this COVID because of this online, all these things, the fast foods and all. We must tell children that this has to be avoided, because this has got long-term side effects which should be taken care of now. So this is all I have tried to uh, uh, bring you about overall health of children in COVID. And uh, we have seen that this COVID, we have seen those days of second wave, when we used to hear so many mortalities, so many deaths, so many hospitalizations, so many admissions. People, we have seen the social media where people were having shortage of beds, had shortage of oxygen. So we all want that this should not happen, and it's a responsibility of each and every one of us, right from the medical personals to everybody, every person in this country, to see that we should avoid the third wave, or even if it comes, it should not be a havoc, it should not be a dreaded. So for that matter, we need to follow the COVID appropriate behavior, which we are saying since last 1.5 years. Thank you so much for patience listening. If anybody wants to have any query, I'm ready to answer. Once again, I thank IDM
Uh,
for giving this opportunity. Thanks a lot.
Thank thank you very much, sir. Thank you very much, Vinky Rughwani, sir. Actually, it was not patientful listening, it was mesmerized listening, actually. It was so elaborative and interesting presentation, and you just touched upon the very big, all the aspects of COVID-19, 360 degree, actually.